Great. Since there was no public participation, we'll move on past the commissioner's response to public participation and to the approval of the minutes. Do I have a motion? I see
Motion
Phyllis's
to approve.
hand and Madden seconds. Roll call vote, please.
Marie Gress,
Yes.
Margie Reynolds,
Abstain. I wasn't here.
Elizabeth Thompson,
Yes. Can you get over
Jennifer-
there, okay?
Jennifer Green,
Yes.
Phyllis Herzig,
Yes.
Brenda McKinney,
Yes.
Allison Foreman,
Yes.
Madden Litton,
Yes.
and I see Jennifer Green here as well. So your vote for, oh, and I see Juliet Ballard too. Oh, Jennifer Green, sorry, I already got you. Juliet Ballard is who I was mentioning. I see you here. We're going through for the minutes.
Yes.
Okay, great. Motion passes. Oh,
Wonderful. Margie, did you have your hand up?
I did. I didn't get any mailings. I got the notice of the meeting, but I got no.
Tracks, yeah. Thank you, honey.
I didn't get any other handouts, and I tried to find the last meeting on the Washtenaw County website, and I searched for quite a while and couldn't find it. So
Yeah, let me forward it to you. Stephanie sent it a little over a week ago.
Can you send it to me too, Marie? I also didn't get the agenda. I got the notice of
Yeah.
the meeting, but just not the agenda.
I'll double check that when I send it again, because I had sent it.
I
a bit
didn't
ago.
get it either.
Oh, maybe I wonder. No, it should have been.
You did
Yeah,
like
I'll-
each of our emails too. Like,
Yeah,
it's weird.
yeah, because I don't have access to the listserv, so I had to send everyone with their individual emails. So maybe people's emails were incorrect on the form I had, but I'll get with Marie, make sure I have everything correct.
Could you, everybody who didn't get it, could you raise your hand and I'll make sure you're on this forward that I'm doing? Jennifer, Elizabeth, Margie, Dina, Phyllis, Brenda. Okay. I wonder if it went to spam
Yeah, maybe since it was from my email.
because Marta hadn't gotten it earlier
Where's it
this
got it?
week and I
Ready?
forwarded it to her. Okay. Just a moment, everyone, while I forward this to you.
Good moment.
Gee, yeah,
Actually.
Elizabeth.
I'm sorry, Marie.
Dina.
Brenda, your microphone is on and you have a lot of background noise. Do you know how to turn your microphone off?
Mm-hmm.
Thank you so
Yes.
much.
All right, so I just forwarded to you all, but I'll share my screen really quick so you know what to expect for this meeting. Share, just the window. All right, so we did our call to order, public participation, response, minutes. Our main discussion item today is the older person's millage, policies, priorities. Dina is actually going to go first, sharing about the HAC's recommendations to the Board of Commissioners. And then I was hoping the millage work group could share out their discussion on the drafted policies. I can then share my update. I took those comments, those notes, and had a discussion with Annie and Jason, and I can give you an update on that. And then we'll pass it off to Stephanie Hall to give us a quick update on state and federal funding updates as she knows of them. We'll have our subcommittee discussions, which I think the bulk of it is really going to be covered in the first discussion. And then by then, Annie will have joined us and be able to give her Board of Commissioner update. Any questions on that? Great. Then Deanna.
Hi, thanks. I'll share my screen in just a minute, just to go over the kind of recommendations, but I'll give some high level overview first because my document is basically a PDF. It's not slides, so it's not quite as easy to follow along. So the Healthy Aging Collaborative spent several months this year really, trying to drill down what our collaborative thought would be the most kind of important priorities for the county to consider when they're making decisions around how the millage funds will be spent. And we worked closely with the Say Yes to Seniors group as well in terms of what they were recommending as priorities. Our intention was to just complement what they were working on, but also to get into maybe more granular strategies on how the funds could be spent. What I've noticed from the Board of Commissioners, is that the more concrete information you can give, I think the easier they feel like they can act on it. So that's kind of what we focused on, is not just taking kind of broad views, but really getting it to concrete ideas. So we've narrowed in on 6 priority areas, and that's improve access to senior nutrition, transportation, support family and informal caregivers, support senior centers, housing, and creating a central hub for navigating resources. So I will go ahead and share my screens, and I'll just go through high level the document we put together. I don't know if you have seen it already, but I will make sure that I send it to Stephanie, and then we can just resend it out to everybody. This document also has been shared with the Board of Commissioners. Okay, can everyone see this okay? Yep, okay. For the first category, and just know that these aren't listed in order of importance. They just are listed as is. In the senior nutrition, we really want to promote the increased use of home delivered meals. Right now, the number of people who need those and who access them, there's a pretty significant gap. So increasing funding to allow there to be more people to get home delivered meals. We want to increase the funding for food pantries, in particular to really be able to address culturally sensitive foods or dietary needs, as well as for both pantries and meal providers, for them to be able to increase staffing so they're not so reliant on volunteers. We're suggesting to conduct a feasibility study to understand the infrastructure that would be needed to build health plans for food services. For those who don't know, this is something that Medicaid is already rolling out. And while not all seniors are on Medicaid, it is still a population of our seniors that could benefit from this, and this would help our food providers to be able to access other funding sources outside of the millage. And then lastly, increasing the number of care navigators that can help seniors enroll in SNAP benefits. This is another gap that we are aware of, that the number of people who would be eligible for SNAP is much higher than those who are actually enrolled in SNAP. So these last 2 are really kind of hitting on, I think, an issue that the Board of Commissioners is interested in, which is using millage money to leverage other money, so that, again, the millage money can go further. For transportation, there's just kind of two areas we focus on, which would be infrastructure, specifically to improve kind of service delivery, emphasizing the variety of options that are needed, door to door, door through door, or on demand, and non-emergency medical transportation. And then mobility management, this is, really focusing on a central entity that can help an individual navigate the right kind of transportation for themselves, whether that means that they could do public transportation or they need to arrange for a private transportation. They need wheelchair vans. Maybe they don't have the income to pay for those kind of services, and so they need help tapping into public resources. Then the next category, family caregivers. There was quite a few ideas that came for this category. Subsidizing respite services, supporting caregiving for those who have dementia or other cognitive impairments, Medicaid waivers, so collaborating with the state to increase access to caregiver support through Medicaid waivers, encourage more caregiver-friendly practices, potentially like providing incentives for businesses to have caregiver-friendly practices in place. Considering creating a long-term care fund. This is something that other states have done, where there's a pocket of money that is dedicated for long-term care services. And then education and training. This is really to help increase outreach and access to maybe the non-traditional caregivers, or those that don't necessarily identify as a caregiver. And then lastly, a 24-hour support hotline that's staffed with live people. For senior centers, our recommendations were to provide designated transportation to and from all senior centers, to allow for senior centers to have flexible funding, including unrestricted funds, so that they can use that for what makes the most sense for their specific center. And ensuring that there's adequate funding to provide mobility and falls prevention programming, as well as congregate meals. For housing, we focused on aging in place strategies. And so some of these specific activities that could be funded are more home health aides, cleaning support, home modifications, and shared living programs. Increasing funding for safety net and urgent needs, specifically to help decrease the risk of homelessness. So that may be like a funding a senior crisis intervention program. That's the SKIP program that we had for many years. Eviction and foreclosure prevention programs, and supportive housing services. Also, like focusing on increasing affordable housing units for seniors, and having a designated fund for innovative housing projects. And lastly, we have the central hub for navigating resources. We're recommending that an office on aging be created within the county, so that this hub could live within that office. Partnering with 211 and Ageways to make sure that there is no duplication of services when it comes to like call centers. So if the Office on Aging has a call center, that there's coordination around what already exists in our community. And then the last one we have here, they kind of go together, which is really to be able to create outreach opportunities to help older adults and their caregivers access services. So we really want to make sure that whatever we're creating through the central hub, that there are warm handoffs, that is more than just a phone number, that there really is somebody who is supporting that older adult. And in some cases, what the last item is referring to is, having some dedicated care management services, time limited, but oftentimes these are more intensive supportive services to really get an older adult maybe out of a crisis and into more stability. All right, I'll stop sharing and happy to take any questions if you have any for clarification.
Yeah, before we take questions, Stephanie, can you capture Marta? Make sure you capture Marta.
Yep, got it.
Cool. Thanks. I see Elizabeth and then Marta.
I would just ask if we could have shared with us a copy of the document you just presented. It may have already been shared and got caught in what seems to be my email blips. But that would be nice to have. Thank you.
I will do that right after this meeting.
Marta, then Phyllis.
Yes, I just wanted to ask, when you mentioned 3 transit centers that are applying for a grant, which ones would those be?
I think Marie knows that.
It's ADA, Wave, and People's Express.
Okay, thank you.
Mm-hmm.
Phyllis?
Phyllis?
Just a thought, maybe through the resource hub, there could be a community education branch that might help people, the general public, learn about resources that are available, and maybe that's where that would live, in that resource hub.
Yeah, I think that's a good idea. I think that, some of that I think was baked into some of these ideas about how to utilize a hub like that. And certainly, education would be part of it.
Allison?
I like this. I think it sets the groundwork for creating a good strategic plan of where this needs to go for the next 5 or 10 years. I would caution that's a lot of stuff. And in the beginning, first few years, we want to make sure we can make an impact and show taxpayers the next time we have the millage up that we've been moving the needle. But one area I would consider adding, what about senior workforce development as a piece? Or the RSVP foster grandparents, which we now know that funding is now in jeopardy as well, as that comes through kind of the AmeriCorps kind of programs. I don't know if maybe as a caveat, as that is now a program that may need to be considered if it's supportive of the aging network.
Yeah, let me just comment on your first point about the sort of the number of ideas. Our collaborative kind of went back and forth on how to manage this. We considered narrowing them down to just 2 for every category, but there was general consensus that we're not the ones making decisions on this, and it's better to provide more information than less to the commissioners, and let them kind of digest it and decide what should go into immediate priorities, like you said. So if in any communication that I've had with the Board of Commissioners, that's kind of the message that I've given, is that we're not suggesting that every one of these is supposed to be implemented this year. I think that we're trying to just give very tangible ideas. And yes, so thanks for the other suggestions.
Adam?
Yeah, just wanna second Allison's point about foster grandparents. There's about 60 grandparents in our county, and it's something that I would be very sad to see go. I also want to highlight the piece about supportive housing services. Thank you for that. That is very needed. It may not get to that, but I'm just happy to see that on the page.
Yeah. Thank you.
Comments, questions? Margie?
You know, I'm a little concerned about way too much here, but you're right. They're all things we need, and let someone decide what the priorities are. But the point someone made about making sure that we can document success, I think is critically important. And I don't know who mentioned it, but we really need to be able to show that, and somewhat early on if we can, and feed that back to the public.
You know, I mean, one of my ideas with a document like this is, you know, if there is some type of task force that's created for the purposes of making these decisions, I would love the opportunity to be able to present this to them with that sort of like understanding that these, you know, these are intended to be, you know, a large sort of bucket of ideas that represent I mean, not everything, but they all represent things that are needed. But of course, that there's going to have to be some prioritization, and maybe it does turn into, here's what we're going to do over 5 years. And you can kind of break this down into what's the priorities for year one, what's the priorities for year two. You know, those are some suggestions that I would make if I had an opportunity to present it. So, you know, we also sort of recognize that as a collaborative of mostly aging service providers, you know, we haven't necessarily been asked to present information. So we're kind of working with, you know, doing what we can in the role that we have.
That's a great list.
Thank you.
Phyllis?
Yeah, I agree. The list is very exciting. And I know the commissioners have mentioned a few times that they want to make sure the public gives them credit for making all these things happen. And so I wonder if there's a way to build in either an evaluation or a progress report to the public, perhaps every 6 months or a year, so that they can hear, because of millage dollars, this and this and this happened and improved the lives, and just on an ongoing basis. So we don't have to wait until 8 years pass and we're ready to go after their support again.
Yeah, I don't recall offhand, but does anybody know if an evaluation was already kind of woven into the framework that was presented?
It is an annual report, and then needs assessments every 3 years to show progress and then current gaps. So those two minimum are baked into the current policy. Marta?
Yeah, I think it's worth pointing out that, you know, the Millage work group, informal work group that's a subsidiary of this Commission on Aging, has been working on feeding information to the county commissioners that are working on the proposal for how to spend the millage dollars. And many of the points that you raised are in what we've already been feeding to them. So it's not like your input is being disregarded. And I think so that this report that you shared with us can probably be shared with that group of county commissioners that are working on what's next.
Yes, I have shared it with all of them, and I actually got a response back from Annie, very favorable. She seemed very appreciative of the information. She said she was taking, you know, the information and And it was helping her to kind of fine tune the framework that they're working on. And I will say too that this was done before the framework was presented. So when I heard the framework, I was very pleasantly, happy with the fact that there's a lot of coalescing. So I am feeling much more hopeful that we're all kind of moving in the right direction. And it's great that you said, Marta, that the Millage subcommittee is also, having some similar, priorities. So I think that the message feels like it's becoming more coordinated.
Mhm. I was just responding to your comment that if you were given the opportunity to present this information, and I just wanted you to know that this information is being shared with the county commissioners.
Yeah, thank you. Appreciate that.
Kind of a nice segue into the next piece of this discussion, which I'm hoping the Millage subcommittee will share out the recommendations that you all made that we passed on to Annie and Jason. Elizabeth or Marta, I'm kind of looking at one of you. Are you willing to share?
I would hope that Marta would take the lead on this because she,
I've got the notes if you want me to share my screen.
I think you're going to have to share the notes. I don't have them pulled up, and I'm having a little trouble recalling.
Yeah.
So,
Let me share
I
my
was hoping
screen.
Elizabeth was going to take the lead, but I'll go ahead.
well, I'll be happy to if you, Marie, can you put it up on the screen? I'll take a start and then Marie, if you can leap in on the things that we missed. We had responded to the most recent iteration of the framework outlined in the policy draft that the three commissioners had presented. We included a definition of our role as the Commission on Aging, hoping to continue to serve in an advisory role as partnering as much as possible with the county commissioners as we are a creation of the Board of Commissioners, and also because each member of our commission has a geographical tie to the specific area in Washtenaw County, we provide some of that county-wide representation that has been an issue that's come up. We also realized that there needed to be a more specific definition of senior center. It's kind of one of those things where we all know what we mean, but it's not written down anywhere. So we came up with a draft list of the entities in the county that we are aware of operating as a senior center, and suggest that that be made specific because some of the future recommendations are based on senior centers, so we need to know who they are. We were already talking about needs assessment that needs to continue because there will be changes in the next 8 years, and we certainly support the concept that Deanna outlined, that being able to give that information both helps in planning and provides a framework within which we can assess our success in meeting needs. We too are supportive of an Office of Aging Services, and we hope again that we as a commission would be able to work very closely with them in developing plans and working in any way we can in helping with the implementation of the millage. And we're very clear on that we believe that the annual report that the Director of Aging Services would provide includes a measurement component so that we can assess the effectiveness, and also that it has data represented to be able to evaluate services as provided in the place where people actually live. So it's disaggregated to the point where we can go and answer some questions about which area of the county are we providing services and to whom. We did notice that there is a question about providing a certain amount of money on an annual basis to senior centers. The framework wasn't clear about, is this per senior center or total amount of money that would be divided? So that should be clarified. And we also are very strong that we don't supplant other funding. And again, we mean by supplant that funding that would have provided that service is taken and paid for something else. It isn't that, unfortunately, we're in the situations already referred to where we're seeing some federal funding potentially disappear for services, and it is not a supplementation to continue to fund services when other funding resources have been removed by the federal government. So we also think it should be clarified how senior centers are going to be supported, whether it's RFP process, whether it's grant process. We didn't express a preference, but just asked that that be clarified. The next point about this is where we're talking about nutrition. Emphasize that food pantries are also part of that network of providing nutrition services to seniors, about a response to immediate needs. And then we did just raise a question. Food, transportation, homelessness, and senior centers appear to be the highest priorities. So given that each of those priorities could absorb probably all the funding in the millage, we need to think about how we're going to allocate that and still allow for some funding under the RFP category where different kinds of projects could be funded. And again, we just asked for some more clarification, and that's going to come through the process of development of the plan for how to spend the millage, to decide how direct services are going to be administered, whether some of them will be directly by the Office of Aging Services, will we use the RFP process, and again, developing a sense of how much funding will be allocated. And I think all advocates for seniors are agreed that we hope to seek as much additional funding as we can, but to specify that the proposed Office on Aging would have as a significant part of its duties, its obligation to try to seek additional funding as possible so that these services can be sustainable. We looked at statements about the RFP process. As you know, RFP processes in the past have had some criticism because criteria weren't as clear, the process for evaluation wasn't as clear, and we would like to, as part of the group evaluating requests for proposals, to be included in developing really specific criteria and developing a process in advance. And we believe that that will make the whole process go much more smoothly and allow a broad variety of groups throughout the county to participate in this. So I think, am I correct that that brings us to the end of what we have? Yes, those were our additional comments. And Marta, do you have anything you'd like to throw in from our discussions?
No, I think you did a great job. Thank you.
And thanks to Marta, Bruce isn't here today, Juliet, Jennifer, and Allison for devoting quite a bit of time to discussions on this. I think it was very helpful for us to understand how the implementation might happen. And also, I hope be able to offer some helpful feedback on some specific points that may help the commissioners as they make the final decisions on implementation.
Thank you. And thank you to the subcommittee as a whole for all the work that you put into that. I had promised to take those notes and meet with Annie and Jason, and we were able to do that. The discussion went really well. They were really receptive to a lot of the ideas. Even if there was areas where they felt like it was going to be too granular for the policy document, they were still taking notes and mental notes about, processes in the future that they want to make sure some of these things get implemented, while also noting that they're getting input from a lot of groups and a lot of individuals. They're talking to other agencies, and they're trying to incorporate all of that. We spent a lot of time talking about senior centers. When Jason first was putting together the really initial ideas for how the millage dollars could be used, he thought that there was only 8 senior centers in the county. We got a list from the subcommittee that had about 10. I added 2, so that brought us up to 12. And another agency had talked to Jason and said that there was 15 senior centers. And so I think that definition of a senior center is going to be really important. And they acknowledge that if there really are that many, we might be looking at different distribution patterns. So they were going to talk more amongst themselves about that, and we'll probably hear more about it the next time that it's in front of the public. Annie, I see you're here now. Is there anything else you wanted to add as far as the 3 of us meeting?
Yeah, I guess on the senior center topic, I've been working on this a little bit this week. I can tell you that it's very unlikely that we're going to recognize 15 organizations as fully functioning senior centers. There's a lot of what I've looked at. Some of those are more like programs that could apply for funding under the RFP process. And so I think what's going to end up happening is we're going to actually bake in the like list into this document and have it set in stone in the policy. Also to avoid random centers popping up thinking that they can get county funding. And so I've mapped out all 9 county commission districts and which senior centers are used by residents in those districts. And then also what like programs are on that list that you all sent that serve a certain area, because like programs are going to have to apply for programmatic dollars through the RFP process. And then there's also there's some organizations that aren't in Washtenaw County and we will not be able to give them millage dollars. And so that's also one of the things that came up in our conversation.
Yeah, so for example, the Milan Senior Center, even though 60-70% of the people using it are Washtenaw County residents, the building itself is in Monroe County. And so that's one of the centers I was advocating for, thinking a little bit more strategically. The county does already contract with them, and Annie and Jason were going to talk with legal about them. And then there was another center that was
I
outside
think
county lines.
Northville.
Northville, that's right.
Yeah.
Yeah.
Yeah. The Milan one, I think the way that we can get around that is we're like having some sort of contract directly with the city. But yeah, we wouldn't be able to give it to like the entity.
Right.
Yeah, so that's a
Yeah.
way to get around that. But and then I also just a heads up that there will likely be a proposal that weighs the opportunity index into the formula because there are some senior centers who are more supported by both like the local government or just because they're in areas where there's a lot more financial support. And so we're going to look at this, the opportunity index, as well as how some of these centers are funded currently and where they fall on that fund map that we like to look at, where there's just like lots of blue and then areas with lots of red. So
I had one more thought from our conversation, and then I see hands raised. The other thing that we talked about was that this millage is really commissioner driven. So the importance of if you have thoughts, like it's great that we as a COA have thoughts, and we're passing those on to Annie and Jason and Commissioner Scott, but also if you have individual thoughts, share them with your commissioner. If the agency in your area has thoughts, share them with the commissioner. They see their emails, they don't always reply, right? But they see them, and it's important to have those relationships. It's important to share that information with them directly. Marta and then Margie.
Yeah, I think it would be helpful, Annie, if we could see the list of senior centers as it evolves and gets, as different agencies get moved from the list of senior centers to the list of programs, if we could have input into that, and obviously because I'm representing a certain district, I'm interested in the senior centers located within that district.
Well, you're muted, Annie.
sorry. I was looking at my screen. So I can tell you on the list that you guys sent us, the one that like would not be considered a senior center, but would be considered like they could apply for the RFP is like the Lincoln Golden Ages Senior Center. In Ypsilanti Township, like the recognized senior center is the Ypsilanti Community Center. So that's one example. And then Marta, I can tell you that like when I was doing the mapping out with all 9 districts, like the Northfield Township Community Center is the one that's listed in my notes. And so um I, I think this list minus the Lincoln Golden Ages is, let's see, 6, 8. Yeah, and then I talked to Commissioner Scott, and she also thought that maybe not, well, I think when we redo the formula, even if it's more than 8, the way if we read the formula, it won't really exceed what our initial projections were for how much of the millage would go towards like the senior center bucket. So it's all going to get worked out, I think, as we weigh the opportunity index, because like for example, oh, actually I don't want to say anything like detailed yet about which areas because I don't want to get
Yeah,
in
I,
trouble.
I get that. But I do think that the Northfield Township is a senior/community center, not just a community center. So that,
Well, right. It's so same thing with Ipsy Township. It's called the Ipsy Township Community Center. It's primarily serving seniors though, and the funding that would be allocated towards that center would be specific to like the work for older adults. And so even though it's not specified like in the title senior center, um we're recognizing it as a senior center because that's what it is for that community. And so like I've talked to your commissioner and I made sure that like that's like for Crystal Light, like it's like Dexter and the Northfield Township Community Center serves the district that she represents. And so I've been calling commissioners and confirming because they're not my district. So I want to know what they know. I know in my district, I have 2. I have the Ipsy Senior Center and I have the Ypsilanti Township Community Center. So
and I think, I don't know what we do about the senior center deserts in the county. That's another question that needs to be addressed. There are certain, maybe townships in the county particularly that do not have a senior center within their boundaries, and how to address those needs is something that I think is being discussed, but needs to be openly addressed.
yeah, I think that when you look at the map, Crystal Lights District, like the east side of Crystal's district, you know, but it's pretty rural, so that's challenging. I think part of this is like, how do we make sure that the support for transportation is helping facilitate better partnerships with folks that are out in rural areas? Because yeah, it's complicated, but when you look at the map and like kind of look where all the people are, like the highest populated areas of Superior Township in Crystal's district, they go to the Ypsilanti Community Center, for example, or maybe to the Ann Arbor Senior Center. So, but yeah, there are deserts for sure.
And the area that you mentioned is a transportation desert as well, so that's considered.
Margie?
Yeah, it's my understanding that some townships or cities already have a senior millage. Is that correct? And if so, who are they? Which ones?
The only one is the city of Milan. That's the only one. And there it's gonna be over in, I think that's done in 3 years, I think 2028. And they're talking about not renewing because Monroe County has a senior millage and now Washtenaw County has a senior millage. Yeah.
Oh, just one.
Yeah.
Mhm.
Yep.
Okay, thank you.
Yeah, Marie, I think maybe something that we can do, since you're the Milan rep, is maybe pull together somebody from Monroe County, and we can maybe pull in our corporation council
Sure.
just to start there, because I think it's gonna have to be like it's either gonna have to be like an inter-county agreement or an agreement with the city of Milan.
Yeah, happy to help. Great. Any other
Uh,
questions? Oh, go ahead.
Oh, yeah, I just wanted to respond to some of the things. I'm trying to remember exactly everything we talked about when we met, but I know that on the feedback related to the RFP process, I one of the things that we talked about is sometimes like people want to be more engaged and help direct that, but we have policies in place just with our procurement that try to remove, especially people who might have uh conflicts of
Conflict of
interest.
interest.
And so it's really hard. What I can tell you is I know that there are some still like maybe negative feelings about how everything went down with the process for the RFP for ARPA funding. I would say that this will be entirely different because the person who's going to be in charge of that RFP process is going to be somebody who's specialized in older adult services. And so they're going to understand what the scope needs to be. They're going to understand the gaps that on the other side organizations might feel if it's not specific or unclear, you know. So I would encourage everybody to try to erase that from your memory, because the person who's going to be in charge of future RFPs is going to be an expert in older adult services.
Marta?
I think in addition to being an expert in older adult services, this person should be informed about how to conduct a proper RFP program evaluation so that they can have in place something similar to what OCED used at one point in terms of having peer reviewers who are trained in how to do a peer review and have specific criteria, et cetera. I think that was more the nature of the criticism that was brought up.
Yeah. So, and then we are gonna, as I'm working through the draft for the next, what we bring to the public, we are gonna get more specific of who's gonna sit on the oversight body. And so I think, once that oversight body is established, there's gonna have to be like, you know, some training around that. And so I agree. I think it's important for people to understand, like how it all works before just throwing them like packets of paperwork. So yes, that's good feedback. And it wasn't in the first proposal that you all saw from the three of us, but in the like mental health and public safety millage changes that we made last year, for example, we got very detailed in what type of individuals we wanted sitting on the oversight body. And so we will be doing the same. And I did have a constituent reach out. I don't think they're my constituent, but just making sure that there are people with lived experience on the oversight body. And so that's gonna get, we're gonna like that will get a little tricky because we're gonna have to make like nobody who has a conflict of interest is gonna be able to sit on that committee. So but it'll just be more work for us, like proactively finding people, to sit on that. So, but yeah, I think that's all good feedback, Marta.
You know, I have a lot of experience in doing peer reviews for national as well as state and local agencies, and I'd be happy to be of assistance if you think it would be helpful.
Awesome. Awesome. I appreciate that.
Elizabeth, then Brenda.
I think a lot of our discussion as a subcommittee looking at comments, especially the RP process, is just the recognition that there are a lot of people with experience, Marta being a great example, Bruce also having on the federal as well as state level and other states, a lot of experiences. Plus, from Marta understanding there have been other uses of the RFP process some years ago in the county that might have a framework that might be able to be used relatively easily. I don't think the discussion was an idea in any way to not recognize those excellent purchasing procedures that deal with conflict of interest. And any of us who've worked in government understand that there are a lot of not immediately obvious rules and regulations that have to be met, especially when you're talking about dollars. So it was just our hope that existing expertise might be able to be pulled in as our suggestion. And
Yeah.
not a criticism, not focused on the ARPA issue. Also, in terms of lived experience, I'd just like to make a personal comment that as commissioners, we were nominated by our member of the County Board of Commissioners because of our lived experience. I think there's been an assumption somehow that none of us participate in any senior programs, and I would hope people would recognize that we bring our lived experience to it. I can certainly speak for myself personally about participation in various publicly funded programs. And I just would like folks to understand that we're all bringing our own experience and the experience of those of us who are in our district. It's not, I think there might be assumption that all of us are just here because we work for an agency that provides services to the aging, and that's not the case.
Yeah, I appreciate that. I don't think that, but I also come to these meetings.
Yeah.
I know who's on the board. So I did let that constituent know that we have people on the existing board that are older adults and, navigating aging. So
Thanks.
Brenda, did you still have a comment?
I would like to say to you, Annie, I want to thank you for your hard work that you have put into this. And I know that you have put a lot of work into it. And also, I'm glad to hear that you're looking at people not serving on a committee that has a conflict of interest, because that is a big concern in the community. People who are receiving and working for nonprofits, making decisions as far as how the millage money is being spent. So I'm glad to hear that. That's very refreshing, and that will be very refreshing to the community as well. And thank you.
Yeah, you're welcome. I think that the way that this is all going to work will be very much similar to the process that CMH has followed since the millage passed for them. We have a pretty robust advisory committee and system in place, lots of checks and balances, lots of community members that aren't just, people that are elected, and real people. And it's important, I think, to have the transparency. And we got a lot of criticism for not having an oversight body for the public safety side of the millage, and we've implemented that now. And so I think it's just always better to have more checks and balances, especially with millage dollars. It's really with any public resources, but I think even especially more with millage dollars, because we're asking residents to pay more into something to benefit others, and they should be able to clearly understand where the money's going and why. So the other thing that I'll mention, somewhat relevant to this, because Brenda brought this up at the last meeting, and I've been having conversations with folks. I'm trying to figure out a way to get this like in words, but we have a lot of really great, like robust agencies that have existed for a long time that have like lots of support and are very like they're like a strong organization. And then we have like a lot of community-based organizations that do work on the ground that, and they're not nonprofits, they're just like community members that kind of have organizations, but they don't have like a lot of like tech support or financial support, but they still do a lot of really good work. And so I'm trying to figure out a way to have like um a chunk of millage dollars that can be utilized for some of those organizations that want to be able to do the outwork on the ground with older adults in their neighborhood, like kind of have more neighborhood hubs. Especially I'm thinking of West Willow. I've met with some of the neighbors there.
Yep.
And we're thinking about kind of doing some sort of like loop in like older adult like millage, and also like looping in some of the work we're doing around climate resiliency, just because of the natural disasters that we're experiencing more frequently and how that impacts older adults who are living alone. And so those are some of the conversations we're having. I'm not entirely sure yet like what the language will look like, but it might be something broad that we would let the future director kind of figure out a process, but something that's more accessible, because there's just people who they don't want to go through the trouble of having like a nonprofit board and dealing with the financial side of it, but they're doing good work and they have connections to people who we don't. And so those are some of the other things that since last meeting I've had conversations with folks about.
Any other questions, comments on policy priorities document?
I'll just say one thing.
You're really quiet. Do you need to move your microphone up to your face?
Yep.
Yeah.
Thank you.
Yeah.
Elizabeth, as you were going through the document, mentioned restricting any of the millage funding to supplement any state or federal programs that may have been impacted by cut of funding. And I think I would be actually okay with the millage dollars covering some of that. For example, like the foster grandparents, right? Like, although like all their funding has been cut, I would be okay with giving them some millage or opening them up to the RFP because their funding got cut, because it has such a big impact on our community and it's so important.
think what we're talking.
I raise
Oh yeah,
hand.
go ahead. Yeah, go ahead.
Doesn't seem to be working, but I probably was somewhat confusing in my explanation. What I was trying to explain is when we talked about supplementation, we were talking about money from the millage going to fund a program where then, say, the county would take the money already funding that program and say, oh, we don't need to fund the program anymore because you're giving them money, we're spending it elsewhere. And then what I meant by my comments about funding ending is we also talked about, we are now in a situation, we'll probably continue to be in a situation where money funding from, say, the Older Americans Act may just end, other kinds of funding may end. And obviously, we're going to be looking at how we can continue as a county. The county commissioners will be dealing with that difficult issue, which we'll discuss a bit later, I understand, in this meeting, about how do we keep those essential services going when the federal government, over which we do not have control, just says we're not giving money. So I don't think our subcommittee was in any way trying to say, well, none of this millage money can go to help continue essential programs, but then you also have the difficult issue with, we've talked about all these gaps where nothing is being funded by anybody right now. and how do we respond to those kinds of needs? So does that help clarify things a little bit?
It really does, Elizabeth. And we heard so much from the forum people that they do want it explicitly noted that you can't move this funding around and reallocate. So I'm so glad it's in there. And thank you for explaining that. On board, totally. Thank you.
Marta?
I think also the intent of that language was to prevent the potential scenario where a township or a city is allocating funds now for a senior center. And then should the senior center receive money from the millage, then pull back that money and reallocate it elsewhere. And we want to prevent that. So we're hoping that the county will ask if they're going to give money to support senior centers in general, that there will be some sort of letter of understanding with the local government that they would not pull funding that they're already allocating since they're getting millage money. So that's another issue that we were talking about.
Great. Anyone else? Super. So up next, I asked Stephanie Hall to give us an update on state and federal funding updates as it relates to aging services. It's her job to keep a pulse on that. And thank you, Stephanie, for agreeing to share some information with us.
Yeah, no problem. So I'll start from top down since I mean a lot of what you were just talking about is potential funding cuts to the Older Americans Act at the federal level. And of course being with Ageways, we're the ones that distribute out that Older Americans Act and Older Michiganians Act funding to all the great people that are doing the work in the communities. So I do just want to start off by saying that at this time there has not been any funding changes officially to the Older Americans Act or to any of our Medicaid programs at this time. So what we are currently operating under is a continuing resolution that was passed earlier this year up until September. And in that continuing resolution, there were not any funding changes to the Older Americans Act programs. That's not to say, some organizations might have been receiving other funding that may have, but yeah, as far as Older Americans Act, no funding changes there. And that's as well as the SHIP program, which helps fund the Medicare and Medicaid counseling that we do through Ageways as well. So that was also included in the continuing resolution. So no funding changes at that time. Some of you, of course, probably most of you have seen an ACL, which is our federal administration, was eliminated. That is correct. That's not uncommon for when new presidents take over that to do a little bit of restructuring. So at this point, ACL has been eliminated, and we are not sure where the Older Americans Act will fall under, but it will have to fall under some other administration. That kind of leads me into that leaked Health and Human Services budget that I'm sure many of you saw a couple weeks ago. In that leaked budget, again, I just want to preface this by this is a leaked draft executive Health and Human Services budget. So really, it's a draft. It's not the official executive recommendation at this time. And even if it was, there still has to go through Congress. So it is far from a final budget. But in that leaked draft, there was a recommendation that the Older Americans Act programs be split between CMS and ACF, as well as some of the Older Americans Act programs were recommended to be eliminated. Things like our preventative health services, like like our falls prevention program, for example, the long-term care ombudsman program, some APS services, as well as some other things were recommended to be eliminated. Again, I just want to say this again, that was just in a leaked draft budget, far from final. So of course, if those were to come into play, at that point, the state does also have Older Michiganians Act funding. We did a lot of work, take the long-term care ombudsman program, for example. We did a lot of work to get increased funding for that at the state level last year. So when there are potential cuts at the federal level, it doesn't necessarily mean that it will be, that it will fully go away. There is state funding. There is, of course, funding through Ageways. There are things that can be moved around. That's not to say it will or won't. I just want to, kind of level set with that. But at this time, funding is still the same. We have not there's not been any changes in our funding through Ageways at the federal level. But I like to say there's a lot of room for advocacy, so I want to just make that clear that I, of course, encourage everyone to share the importance of the Older Americans Act and share stories about all the great work that these organizations and then these organizations do, and share stories about the participants that it serves. But yeah, that's kind of where we're at the federal level. At this point, no budget cuts as of now. And the same with Medicaid as well. With reconciliation that's kind of going through right now, there have not been any official cuts at this point. So everything's operating as it was.
Any questions at the federal level?
Yeah.
Super. Oh, Elizabeth.
Again, my raise hand button isn't
Love it.
working. So
It works.
this is kind of putting Allison on the spot, but because of her professional work, I was wondering if she might speak a little bit about potential impact on senior nutrition programs.
So I've been fortunate enough to talk with like the senators in the state of Ohio, because now I'm working in Toledo, and they are both Republicans. So, they're more on the conservative side. They are both toeing the line that they are going to protect Social Security, Medicaid, Medicare, and safety net. They've both verbally said they're supportive of nutrition services and trying to protect that. John Husted he sits on the aging special committee at the federal level, and I've had talks with them. He's been in talks with all the other committee members at the aging special aging committee at the federal level, and they are quite aware of wanting to protect nutritional services. And it seems like it is nonpartisan right now in that committee, and those would be the ones kind of making that recommendation from a budget perspective. Again, to like what Stephanie's information, that is true. Like there was that leaked budget. I actually asked about it, and they kind of said the same thing. They said that budget got out. I don't think that is going to be remotely what is going to be put up for consideration. Again, they said that's just their from their lips, but that's one person who sits on a committee of 10 or 11 folks. So far they say don't be scared about that. The thing we were most a little bit concerned about is I know I'm a program that gets insurer funding, and so we are a little bit more worried about our Medicaid programs, like our dual eligible Medicare, Medicaid clients. So those are like passport and waiver clients. So that is maybe more of a pot of money, and that's not our significant pot of money, and I don't think it is for many meal providers, but it still would have an impact that then would have to shift to regular nutrition services. So I think right now the advocacy is really good for older adults at the federal level, and people are hearing us. So if you've made calls to your federal politicians and to politicians at the state level, I think they're really hearing us. I'm seeing positive stuff in a lot of the states regarding senior services. I hope that's helpful. And if I get anything new, I mean, I will forward on to Marie so that she can send out to the group as well. So if I get any updates from anyone, I'll for sure pass that along to folks.
Yeah, and I second that. Even in the executive leaked again budget, there wasn't cuts to nutrition through that. I do, kind of backing what Allison said, that this is this was leaked from what we've been hearing from our members of Congress who this was not discussed anywhere. Even one of my coworkers is doing some work with ACL, who again was eliminated, and they hadn't heard any of this with programs being moved mostly to CMS. So it does kind of seem like this is far from what will actually be final. And just as note, under the Older Americans Act, it is in statute that it does have to be under some sort of administration on aging, and it does have to have some sort of assistant secretary on aging. So if they were to break Older Americans Act programs and put them under CMS and ACF, that goes against statute. So not as easy as just throwing some on, which to us, it doesn't make any sense to split them up like that and to put mostly under CMS. So, but I don't want people to think that there's not needed room for advocacy, because there always is. And then, at the state level, they're working on the budget right now. So, not too much to, oh, Elizabeth, did you have, question? Go ahead.
Could you, when you're talking about state advocacy, talk a bit about Older Michiganians Day?
Yep, I'm gonna touch on that. That's yep, you beat me to it. So yeah, at the state level, the committees are working on their budgets currently. So operating, going through the process. We're still waiting for those to come out. So kind of operating as is. They're not quite as tumultuous and crazy as what we're hearing at the federal level. But Older Michiganians Day, what Elizabeth said. So that's kind of our biggest advocacy event at the state level. So that's held on May 7th from 9:30 to 12:30 on the Capitol lawn in Lansing. If anyone didn't see the information for it and wants to attend, let me know, just so I can make sure to get a accurate count of how many people from our region will be attending. This is a really great event where we bring a bunch of people onto the lawn to hear a great program about our advocacy priorities. We have legislators speak as well. And then legislators and legislative staff come down to the lawn and grab lunch and talk. And so you have a great opportunity to meet your local reps and senators as well that day. So the weather's looking really nice. So it'd be a good excuse to get outside. But if you're not able to attend in person, we know, of course, there's other things going on. There is a virtual link as well, so you can join it virtually and attend and watch the presentation. So I'll make sure that information gets out. Again, it was in the email I sent a week ago that looks like people weren't, or I guess Marie, you just resent it. So everything should be in there for you. So if you're interested in attending, let me know. Being that budget season is lasting longer than it has in previous years, and going well into the summer, usually when we're doing this in May, we have, maybe a month left of budget advocacy, but we have a lot of time now. So great opportunity for people to attend and speak to the state legislature about their advocacy priorities. And we're also doing, I have to mention, a letter writing campaign as well. And we're doing it, we have a link this year that you can just sign online. You don't have to sign paper copies like we've done in previous years. So please take a moment to sign that to support the Older Michiganians Day platform, and then share it with your networks as well. We're trying to get at least 10,000 statewide. So yeah, happy to answer questions or elaborate on anything more if people have questions about what they're seeing.
I have a question. So I saw that the governor's suggested budget included an increase of 2 million for older adult programs. Where specifically are those dollars being targeted? Do you know?
That was so because in her executive, well, last year there was but I can't remember what the program is. It doesn't impact our programs. I'm trying to think about what the recommendation was. Let me look it up, because we had that same question. I think it was just like a small community or something specific. I'll have to look more into that.
Super. Yeah,
it doesn't impact our programs.
I remember when I glanced over it, there was nothing in it for older adults and transportation, and I was looking specifically for that because at the state level, they are decreasing local bus operating formula funds again. It's a 10% decrease over the last 2 years. And so for an agency my size, that's a loss of between $200,000 and $400,000, the several routes on the road, and it's concerning. So I know that I've reached out to the governor and my representatives about transportation. It's not included explicitly in older adult services, in those funding pots. And I'm sure, Madden, you guys are watching housing at Housing Bureau for Seniors. It's probably a similar scenario where it's not necessarily explicitly in aging services funding, but it is being impacted at a state level, hits us at a local level.
Yeah.
Allison.
So just a caveat, because I know we're talking about budgeting and at state levels and just millage and program, just, the tariff stuff is real as a agency that provides food. So our kitchen, we just got something, so we work with Gordon Foods as our primary food provider for the raw goods. They now have enacted on our contract pricing list, because we're part of a buying group, and a lot of places that, do large scale food production, they now are enacting on our order form. It hasn't taken place yet, but if I say have a contract price for bananas and it's $40 a case, and those bananas now come from Mexico or they come from South America, there's now a red line that says, in addition to your CP price, your contract price, there is now this tariff price increase on your raw food goods. So considering food costs too for this, going into the future, I don't know if there's any way in state budgeting or any of those kind of things where anyone's trying to look at how flat funding is going to still be a challenge with the increasing older adult population, but now this increased cost from the food perspective could be 20%, could be 50%, like take coffee, for instance, right? There's no way that's produced here in the US. So that is going to have anywhere from a 30 to 100% tariff on it. So there are items like that. So I just didn't know if, like, even if maybe that's something more from an Annie perspective or Stephanie, like if there's any way that that's being advocated when considering for budgets at the federal and state level.
Yeah, we consistently say, in previous years, we've always advocated for, of course, like increases, keeping up with inflation, those types of things. And we do say, even if, like how we've operated on level funding for this past year, we consistently say, even with level funding, that's still a cut, because things, we're able to serve fewer people with that level funding. So yeah, we do use that a lot. We say that consistently in our advocacy work. I do want to mention at the state level, we the Silver Key Coalition still operates, and we look at that as well as trying to advocate for increased funding for home delivered meals and in-home services. And we talk about that a lot with addressing the wait lists. And if we're not able to increase funding for that, we're going to be able
to pros. Well, any other comments on federal or state funding?
I'll just say there has been.
Sorry.
Sorry, Stephanie.
I was just saying I froze in it. I'm sorry if I missed anything.
I'll let you finish, Stephanie, because I think we didn't hear you.
Oh, where did it cut off?
Reallocating.
Oh, at the state level, the Silver Key Coalition. Yeah,
Yep.
so at the Silver Key Coalition, we're continuously advocating for increased funding for home delivered meals as well as in-home services, and addressing the wait list for those programs. And when we do a lot of that advocacy, we also talk about how if we don't put additional funds to support those programs, I mean, we're right now able to serve fewer people just with the costs. And of course, Michigan is the 4th fastest aging state. So as we continue to have more older adults, if we don't put additional funds towards those programs, there's going to be even more people without. So yeah, we do talk about that a lot. With maintaining funding is great. It's at least not cuts, but we really need to be putting additional funding.
Thank you,
And then
Stephanie. I was going to mention that the minor home repairs funding has been cut pretty drastically in our county. And so while y'all all are here, definitely emphasis on that in the millage and keeping aging in place a priority.
Yeah, and that's a great one for our millage counties that have, because in our region we have 6 and 2 of them don't have millages. And like chore services and some home repair are some things that we're definitely not able to meet the need through the little that we're able to do through the Older Americans Act. So it's a big gap for our non-millage counties.
Great. Anyone else? Thank you, Stephanie. I really appreciate it. And plug again for Older Michiganians Day, May 7th. If you didn't get what I forwarded from Stephanie, send me an email and I'll send the attachments to you directly. All right, next on our agenda is subcommittees discussion. I know communications, we don't have any. Millage work group, we talked about your updates already. So town hall, any updates you want to share? Nope. Future planning, any updates you want to share? Nope. Great. Then we're on to report from the Board of Commissioners. Annie, is there anything additional you'd like to share?
Yeah, the only thing I'll add, and I haven't seen it yet, and I'm not in board leadership anymore, so I don't have the same access to information before the rest of the board gets it, but we have an emergency kind of funding resolution that we're gonna have on the agenda next week for 2 things. Uh, to replenish skip funding because it ran out in the fall, and a staff person flagged it at the time, and we are trying to fill in some urgent gaps on food pantries because of USDA cuts. And so the resolution will the resolution will just be specific to providing emergency resources to food pantries that serve older adults and to replenish skip funding. I don't have any more details right now, but it's meant to be a quick urgent response to some needs that already exist and not to be overly complicated. Our goal is to have the proposed millage language passed hopefully by the second meeting in May, or the only meeting we have in June. And so like I don't want that to alarm anybody, but we're trying to not make it complicated and fill an immediate need because of the USDA cuts. So hopefully that doesn't worry any of you, but if it does, let me know. I can take the heat.
Any questions?
Thank you, Annie, because the Barrier Busters funding for eviction is basically gone. And so
Yeah.
there are so many of my seniors who I can't help right now because we don't have any money, but could be homeless any day now. So I appreciate that very much. And that'll be super helpful.
Thank you. Yeah, if you want to come give public comment and support it, feel free. Although our meeting might have lots of public comment on Wednesday, so you might want to call in. I see.
Dina, then Elizabeth.
Annie, I just wanted to see if I had actually emailed you about this, but just since you're on right now and talking about this, it's kind of relevant. There's some information I think you're sharing that would be really helpful for the Healthy Aging Collaborative to hear. So I'm wondering if you would be willing to come to our next meeting, and
Yeah,
just
I
talk.
saw that email. It's the 15th.
Mhm.
Okay. Is it virtual?
It's in person, but we can offer a Zoom link for you.
Okay. I might need a virtual option just because things are a little crazy at work right now. In the Senate, we're still pretending to play government, and so budget stuff's happening on our side. And I have to be there. So,
Yeah.
Okay.
but yeah, I will if I can be there in person, I will. But if I can't, I can call in. And then I know somebody else reached out to me that someone connected me to, and I need to call them back because they called me, like, I think it was you. I can't remember the person's name, but I need to get back to
Probably
them.
Phoenix.
Yes,
Yeah.
Phoenix. Yeah.
Okay. All right. Great. Thanks.
Yeah, you're welcome.
Elizabeth?
I know that we've, in terms of the millage, had indicated our support for food pantries as being an essential part of nutrition programs for older adults. So I'm wondering if it might be possible, Marie, just to send us a little something about this resolution and when it's going to be discussed. And then we as members of the commission can indicate our support.
Yeah, when it's posted, I'll share it.
Yeah, I don't think the packet's out. I don't have the
Oh,
packet
it's
yet.
not.
So yeah, I don't think so. I haven't checked my email, so I don't know. But yeah, and sorry, like we haven't had a meeting since it got brought up at one of the forums that Jason and Shannon had, and then me and Katie gave some feedback to county admin staff about what we consider an emergency, and then some other work happened behind the scenes that I wasn't part of, but and I'm just not really, I don't have the same information not being on board leadership, so I don't see the packets until you guys do. So
Great. Anything else? All right. Anything else you wanted to share from the Board of Commissioners, Annie?
I don't think so. I'm working really hard to take all the feedback that we've gotten from a lot of different entities, and trying to find time to get back together with Jason and Katie to make some final decisions so we can kind of close the deal, on this and get things rolling. So, I appreciate all the feedback that everybody's given, both from the COA and also in other capacities that you all work in. And, we're trying to make it a good policy and get something done so we can start getting the rest of the dollars out.
Super. All right, next item is report from the chair. I don't have any new information for you guys today. Any new business anyone wants to raise? No. All right, then and we'll get out early. Our next meeting is June 6th. We have Catholic Charities, formerly Catholic Social Services of Washtenaw County, now Catholic Charities of Washtenaw County, coming to talk about their senior programs, including their maintenance program, their case management program, and I think there's another one that they've been working on, but Casey Kerr will be here to present on that at our next meeting. Motion to adjourn?
So moved.
So
Support.
moved. Support. Thumbs up. If you are good, great. Meeting's over. We'll see you next month. Thank you, everyone.
Awesome. Bye, everyone.
Bye.
Everyone.